Welcome to the Science Her Way podcast. I'm Kelly Pritchett.
I'm Anna Freire.
And I'm Robert Pritchett.
We are the co-hosts of the Science Her Way podcast. Welcome to a journey that celebrates innovation, empowerment, and science. We are thrilled to introduce you to Science Her Way, a podcast to explore the wonders of health and sports sciences. So fasten your seatbelts because we're embarking on a thrilling expedition through the world of health and sports sciences, driven by the relentless force of curiosity. Stay tuned for more engaging conversations, remarkable stories, and a celebration of Science Her Way.
Welcome to Science Her Way. I'm Anna Freire.
And I'm Robert Pritchett. And Anna, today we have a very special guest.
We do. Today we have Kelly Pritchett at Science Her Way. Dr. Kelly Pritchett is a professor in nutrition and exercise science at Central Washington University and serves as the director of sports nutrition for CW Athletics. It's such a pleasure to have you here with us today, Kelly.
Thank you for having me on the show. Yes, I'm Kelly Pritchett. I am a professor in nutrition and exercise science at Central Washington University. I also oversee our master's program in nutrition and the sports nutrition program for CW Athletics. My passion is definitely in the area of sports nutrition, and hopefully we'll get to dive into some of that today. I'm also a mom to 3 boys, and I am a wife to Dr. Robert Pritchett.
She is my wife.
Okay, so let's discuss a little bit about the role of women in science. That's one of our great missions here at Science Her Way. So I know you work in a field that it could be very male-dominated. So how do you see that, and how have you seen the landscape change over the years?
Yeah, that's a great question. I was a swimmer at the University of Alabama and really got interested in performance at the time, and was doing an undergrad in nutrition and decided to go on and do my master's in exercise science. And so at the time, you start reading research as a grad student. One of the things that I really noticed is that, wow, all these studies have been done on males and they don't include females. And so, fast forward to now, we're starting to see a real push for including females or active females in a lot of the research. And I think, historically, the menstrual cycle's been used as an excuse to exclude women from studies. And we don't know how that could impact study outcomes and things like that. So, Dr. Kirsty Sell, for example, has been a real big advocate in this area. So it's exciting to see, a push to include more females in research. And then also, too, I just have to say that a lot of my mentors in the field of sports nutrition and sports science were females. And so I'm just so forever grateful to them.
Yeah. Kelly, how did your career as a student athlete shape this interest in sports nutrition and maybe the female athlete in particular?
Yeah, that's a great question. I think at the time we didn't have a lot of resources from a nutrition standpoint, and looking now at a lot of collegiate programs, they have at least one full-time sports dietitian working in the athletic department. At the time, we did not have one, and I went through a period of time as a swimmer where I did not have my menstrual cycle for a year, and what I now, looking back, was an unintentional low energy availability. I just simply was not fueling enough, and subsequently had a stress fracture in my heel, and so, I think I just wish that I had the knowledge that I have now from a nutrition standpoint and how important it is to fuel. And so that's one of the reasons why I'm passionate about sports nutrition and some of the research that I'm currently working on.
That is very cool. So now that you mentioned about your research focus, what motivated you to study this particular topic, and what are the highlights of your research?
Yeah, so, as I mentioned, there was that interest as an athlete, and then some of the things I've observed as a practitioner. And from a research standpoint, I started out in the area of recovery nutrition and moved into the area of nutrition for the para-athlete. And then now I'm focusing more on low energy availability in athletes.
Kelly, could you talk to us a little bit more about low energy availability in athletes and maybe how, what the long-term consequences are of low energy availability and sort of what period of time does it become an issue?
Mm-hmm. That's a great question. So low energy availability, to define, is a mismatch between energy intake, or the calories that we consume, and exercise energy expenditure. And so if you look at the calories that are left over after we account for exercise calories, those are needed. Those are the calories that are left over to support vital function. So whether that be endocrine function, metabolic. So when we don't have enough energy to support those systems, we have, negative health and performance consequences. And so just recently, the 2023 IOC REDS paper was published, which is very exciting. And it really talks about, low energy availability occurring on a continuum when we see some of these physiological outcomes associated with REDS. And they introduced this concept of problematic low energy availability, which talks about the frequency and the duration of and the magnitude of exposure to low energy availability. And it's just something that I think we're really starting to understand a bit more, but there's a lot to be learned in terms of how problematic low energy availability impacts some of those physiological outcomes associated with REDS.
So I can only imagine from a lab perspective, because that's my sort of background, it's difficult to measure energy expenditure. How are practitioners and scientists like yourself measuring energy expenditure amongst athletes?
Yeah, so in that low energy calculation that I talked about, which includes energy intake and exercise energy expenditure, that is, one of the problems. Several years ago, a threshold of less than 30 kilocalories per kilogram of fat-free mass per day was kind of flagged as the threshold, and then that's when we start to see these negative physiological outcomes, like for bone health, for example, or menstruation stops. But I think if we look at that model closely, what we've learned is that, it's very difficult to get a true representation of energy intake and exercise energy expenditure for many reasons, whether it be underreporting on diet records or over-reporting, and then capturing energy cost. And so now, for example, what we've used in some of our studies is the LEAF-Q, or the Low Energy Availability in Female Athlete Questionnaire. And it's been clinically validated in low energy availability populations to identify risk of low energy availability.
You mentioned that is a quite new field of study, but do we have a sense on how prevalent that is among athletes?
Yeah, researchers really work to look at the prevalence of low energy availability in a lot of sports that we tend to think of, like running, for example, which I'll talk about, in some of the more aesthetic sports where shape or weight might be a concern. And so I would say, based off a lot of the studies, we know the risk is somewhere between 40 to 50% in these types of sports, is just looking at a lot of the papers that have been conducted. So risk is there. What I would like to see done is capture some of this in ball sports like soccer, rugby, softball, so some of the sports that are maybe overlooked from being at risk.
And why do you think that's such a high prevalence? What are the factors that are affecting this high prevalence among athletes?
Well, in the sport that I talk, so running, for example, we'll use, I think, there's this idea that lighter is faster. There could be pressure from coaches, pressure from teammates. So just this misconception, or there could be inadvertent underfueling. So just not understanding how much energy they need to be consuming. I mean, I am shocked at, athletes that I will work with or consult with, and they are, from a carbohydrate standpoint in particular, way underdoing it. So I just don't think there's this mismatch from a knowledge standpoint. And so really we got to do better from a primary intervention standpoint. And that is one of the things that's really emphasized in this new REDS update.
To give us an idea, you work with some elite athletes. What sort of duration or what sort of time frame are they spending training in a 24-hour period?
Oh, man. So you said elite or?
Elite athletes that I would think maybe are unintentionally underfueling.
So this could be 4 or 5 hours a day of training that they're engaging in, and then they have other, maybe they have jobs, they have other responsibilities, and so if you think about it, they really need to be constantly fueling, and so it can be difficult to do without the knowledge, and I think that's really where the sports dietitian comes in and can be a real asset.
Yeah, and what can we do to overcome those? Because I think, what are the main consequences of that? Are there any like health issues that might be related to that in a long-term perspective?
Yeah, so I think if you look back at what a lot of people may be more familiar with, the female athlete triad, and there's years of research to support the relationship between low energy availability and or disordered eating, which leads to amenorrhea or a lack of a menstrual cycle for 3 or more consecutive months. And then, the third component in the female athlete triad being osteoporosis, and the fact that this occurs along a continuum, of course. But then if you look at like the new REDS conceptual model and other physiological outcomes, we start to see negative ramifications for iron, for example. So there's hematological outcomes. There's endocrine outcomes as well that are negative. Sleep is another one that was updated in this new model. And then in males, so we haven't talked about males, but, I think one of the things that was highlighted as well is how do we identify this in a male athlete? They don't have a menstrual cycle, so looking at libido or sex drive could be something that's impacted negatively in our male athletes.
That is very interesting. Just as a curiosity, is that a timeline that low energy availability starts being detrimental? Like, is that a week, a month, a year? How long are we talking about?
Yeah, that's a great question. And going back to this concept of problematic low energy availability, it really depends on the duration, the frequency, and the magnitude of of the energy deficit per se. So you think about someone that's, maybe in a 300 calorie deficit versus 1,000 calorie deficit. And so I think we have to acknowledge there's probably individual variation as well. And so, one person might be a little bit more sensitive to this than someone else. And there's been some research in male cyclists specifically. It kind of shows that if they're in sort of acute low energy availability, they might not have the same ramifications that we see in, for example, a female athlete. So the female tends to be a little bit more sensitive to the energy deficit than, say, the male. And that could be just due to the fact that, the female body's designed for carrying babies, and for reproductive purposes, we may need a little bit more energy.
are you talking about comparing male cyclists to female cyclists, or are you talking about maybe across various sports where possibly a sport that doesn't have quite as much muscle damage impact, like running versus cycling, has a different threshold?
Oh, I don't know if I don't know that the. Can you say that?
Distinction has been made between sports.
I just think of cycling as a good example because they can get away with higher volume, so that from an energy deficit standpoint, the exercise energy expenditure, it's a little bit easier maybe to create that.
So
deficit.
It's not dependent upon loading versus unloading, or
no, not from an energy standpoint.
or repair perspective.
No, but that's a good question. We currently we just have a survey out with looking at cyclists and risk of low energy availability, disordered eating, and exercise dependence, and their fueling habits to try and get a better idea of the risk in that population.
Yeah.
And what do you think are the main key practical things that we can do to prevent that, or even to maybe reverse it if we identify athletes that are already in that stage?
Mm-hmm. Yeah, so primary intervention should be, I think, which would be education. So should really be emphasized. And I think that this needs to be done at the high school, maybe even middle school level, where we're going in and we are educating coaches and other individuals who may be involved, the athletic trainer, who are providing care for the athlete, so that they know what the risk, what some of the symptoms or red flags look like, so they can identify this. And then furthermore, I think, educating the athletes and parents as well. So starting from a young age would be, I think our first line of defense. We need to do better.
And what are the red flags?
The red flags. So, things you might look for. If you have an athlete that is not adapting to the training, they're fatigued, they're irritable or they're anxious. Weight loss may be, that's not always the case. We're not necessarily going to see that. As I mentioned before, the menstrual cycle can be a good indicator, as long as we don't have PCOS or something else going on.
And in cases that we do identify low energy availability, what can we do to reverse that? It's also an educational standpoint, or do we have more practical applications to that?
Yeah, I think that's a great question. Hopefully the coach, this is where the education comes in. And so, the coach could go to the athlete and say, I noticed X, Y, and Z. We were just briefed on REDS and low energy availability. I'd like to refer you to a sports dietitian. So, hopefully having those individuals in your area so they can help in the case that you do identify someone is at risk. So if we have someone with disordered eating, then we definitely would want to include a psychologist to help with some of that as well. And if we're trying to get a true diagnosis of REDS, you do need a physician to make the diagnosis.
Okay. How is the diagnosis done? Is there one instrument? It's a combination of the symptoms and the maybe questionnaires? How's that?
So the REDS CAT-2 has just come out, and it's a great tool in that you can start with something like the Leaf Q to see if the athlete's at risk, and then if they're at risk, then you take the next step in this REDS CAT-2 tool.
Is that a questionnaire? Is it a questionnaire? A scale?
It's cumulative risk assessment tool. So it looks at a few factors, and like bone mineral density, amenorrhea, or lack of menstrual cycle, bone stress injuries. You can use the eating disorder examination questionnaire that looks at risk for disordered eating. So it takes into account a few different factors. Hormones is another one. And we'll put the athlete in a category based off risk. So they will be green. I think it's green, orange, and red to determine what the risk is. And so obviously if an athlete's in the red, then they need to be referred to a physician who would then make the diagnosis. And so this is really new, meaning that I haven't used it in practice before, but we actually have a grad student next year who is going to implement the use of this tool in some of the ball sports on campus at CWU.
That is really interesting.
How clued in do you think coaches are on the prevalence of low energy availability among their athletes, or clued into the signs and symptoms of the possibility among female athletes?
Yeah, that's a great question. I would maybe back up and say that it's a question of maybe they know, but do they care about the athlete's health more than performance? And so I think we really have to emphasize health first, performance second, number one. I'm not sure that they know how to identify the signs and symptoms. That's a great question. That could be a good research idea. Yeah. But getting them maybe thinking about historical, like for running, for example, this idea that athletes need to be lighter and that's going to be faster. They should avoid carbs. They should avoid breadsticks when they go to Olive Garden, that type of thing. Like, I think we have to change
that rhetoric.
That conversation, and hopefully educating them will help. But
I don't know if we have studies showing that the relationship between the presence of low energy availability and performance. Do we know that that already impacts performance?
Yeah, there are a few studies that have examined performance, and part of the REDS model is a decreased, or the conceptual model is there's some decreased performance outcomes. So we see things like decreased glycogen levels, for example. We see decreased aerobic performance, decreased muscle strength. So some of the studies have looked at these outcomes.
So even if the coach is aiming for performance, he should be concerned about that. We should be looking into that as well.
I think unfortunately in weight-dependent sports there's a continuum, like Kelly mentioned, and at some stage lighter for an acute period of time might be faster, but over a period of time, it's very detrimental. Right. So getting the athlete and the coach to realize that through training and proper nutrition, your body will do what it needs to do is very, very important. And you will benefit from your training to a greater extent if you fueled correctly, and for them not to be so focused on this sort of acute response of being lighter. Am I correct in saying that?
Yeah, and I think there's a study that really stands out in my mind, and I love this study because I do think maybe we can show this to coaches. In 2014, there was a study, it's published in MSSE on swimmers, and they divided the swimmers up, I believe, based off of, I can't remember if it was energy availability, but I feel like that was the case, or those that were amenorrheic. I think it was amenorrheic, and those who were eumenorrheic, or having a normal cycle. And the amenorrheic swimmers were in a calorie deficit, and they had higher BMIs, higher body fat, and they swam slower at the end of the season than the group that was eumenorrheic, or having normal cycles. So the normal cycle group had a lower BMI and a lower body fat, and swam faster from a performance standpoint. So, I think trying to make these changes to body composition, sometimes doesn't give us the outcomes that we want. So
Yeah, and typically in a college season, the end of the season is most important. So
Right.
if you're not getting that correct,
mhm.
performance at the big events typically does suffer, which is tough.
So you mentioned that proper fuel is the way to go, right? So what is that? What is proper fuel? What can we define on that?
Oh, that's a great question. So eating enough to meet your energy demands of training as well as just other life demands, and so you know what that looks like is going to be different for every athlete from a number standpoint. But I think the athlete can look at some of those signs and symptoms, like I mentioned before. Are you hungry? Paying attention to your hunger. On rest days, you might feel like, hey, I'm a little bit hungry, or well, maybe you're catching up from the other day. So don't ignore that. So it's not, I don't necessarily think of it, as a number per se. As a dietitian, we can definitely help our athletes, identify, but it could just be adding 300 extra calories to your day. That could be, really emphasizing the exercise snack being a little bit higher in carbs, focusing on that recovery, post-exercise recovery meal, and are they getting the amount of carbohydrate and protein in that snack that they need? Maybe they need a pre-bedtime snack to help, increase their energy intake.
That's great. And you are actually doing research on that now. Could you talk a little bit about that? What is your most recent or more interesting study that you have going, and maybe key findings that you can share with us?
Yeah, so the most recent study it's in review by the International Journal of Exercise Science. Myself and Keely Henninger, who is a professional trail runner, came very interested in the sport of trail running. It's a sport that's grown, and there's really not a lot of research in that population. And if you look at the volume of running that a lot of these individuals do, from an energy availability standpoint, it became interesting to us in that are they at risk for low energy availability? And so in that study, we used the LEAF-Q, the Low Energy Availability in Female Athlete Questionnaire, and found that about half of the trail runners in a population of 3,000 between the age of 18 and 40 were at risk for low energy availability. And so we have another paper coming out hopefully soon in the Masters runners. So that will look at the 40 to 65-year-old group. But
Glad you're not shying away from us older wannabe athletes.
And
Kelly, sorry, Anna. Kelly, trail running, what distances are these individuals running? What's the sort of average range of distances for trail running? Because I gather it's not like your local 5K in town.
I think we tend to think of 50K as maybe the classic distance, but you may see some 25Ks up to 100 milers, maybe even 200 milers.
Yeah.
Which is so crazy.
Excessive distances and huge energy demand.
Right.
Over varying terrain.
Mm-hmm. And one of the other things we looked at in that study was risk for exercise dependence. And we did find that really a high majority of them were symptomatic for exercise dependence, not necessarily at risk per se, but
for us more ignorant in sports, what would be exercise dependence?
That's a great question. We could probably do another podcast on this, but exercise dependence could also, is a term that's used to describe exercise dependence or exercise addiction, compulsive exercise. And it's not actually identified by the American Psychological Association in the DSM-5 as a true psychological diagnosis. So there's proposed criteria similar to substance abuse, and this proposed criteria comes from Heather Hassenbloss and her colleague, I think it's Danielle Downs, but they created what's called the exercise dependence scale, and that's what we use in our study, but it looks at things like withdrawal, for example. If I don't have exercise, then I have these withdrawal symptoms, which we may all be able to relate to, right?
Oh, yes.
Which is why, you think of these trail runners who are doing high volume running and they're not able to do it, then they're going to experience some of these symptoms. But there's 7 different categories: continuance, so continuing to exercise when I'm sick or I have an injury. I feel like some of those are a little bit more red flag when it comes to exercise dependence. But again, it's just assessing risk.
Interesting. And what do you think are the practical applications of those findings? So if you are giving some advice to sports nutrition or professionals that are working with this population, what would be your message for them?
Yeah, so I would say, symptoms of exercise dependence, and we were trying to look at the association, but between exercise dependence, disordered eating, and low energy availability, and whether these were red flags. And so one of the conclusions is that really exercise dependence and disordered eating may be red flags for identifying risk of low energy availability in trail runners. The other interesting thing, and this study we could talk about for a while, is we found that we looked at fueling strategies in this population as well. And so we asked the athletes if they were meeting the recommendations for carbohydrate intake during activity that lasted an hour to 2.5 hours in duration, which is 30 to 60 grams of carbohydrate per hour. Most of them, or the majority of the runners, did okay with that recommendation. But then when we look at durations greater than 2.5 hours, the carbohydrate recommendations go up to 60 to 90 grams of carbohydrate per hour. And so that's an area where we found the athletes weren't doing so well, or the trail runners were not doing so well. And reasons, again, another research idea is why. What are those barriers? Is it GI symptoms? What's causing that? But I do think that's something that could be emphasized.
And this was a questionnaire, so these athletes were reflecting back onto training and racing, correct?
Mm-hmm. And we looked at training and racing.
Yeah. So maybe during training, it's harder to carry that amount of nutrition. However, during races, the availability is a bit easier.
Well, we actually didn't find a big discrepancy between what they did in training versus racing, which was interesting.
Yeah.
I just think that 60 grams
Is a lot.
Maybe is a lot, and that athletes are maybe not training the gut, they're not training with it. So I feel like there's a lot of work that can be done there. But we also found that, risk of low energy, those who are at risk for low energy availability were less likely to meet those fueling recommendations, which makes sense, but then that's also contributing even more to their energy deficit too.
Have you looked at recovery and low energy availability over time and what happens to recovery?
Do you mean, are there negative
effects on recovery?
Definitely, and I think that's why you would see, if we talk about some of the red flags, or an athlete that's not adapting to the training.
Sure.
So they're not recovering properly from a fueling standpoint, then they're not going to adapt to the training stimulus.
In your, I don't know if you mentioned that, but are there any studies comparing if women, female or male athletes are more likely to develop lower fuel availability? Male or female are more likely to develop that, or no?
So research is focused more on females, because I do think we tend to stereotype the female athletes, maybe going to be a little bit more concerned with their physique, that type of thing. I just think, historically that's the notion. Whereas, the male athlete, I would say, is probably less likely to admit they have a problem. So, it's maybe the difference in the way that it presents between the two that I would say is interesting.
Yeah, agree. And what are the main final messages that you might have? Advice maybe for the clinicians and maybe some advice for the athletes as well?
Yeah. So I think first and foremost, if an athlete has low energy availability, restoring the energy deficit is going to be necessary for, optimal health outcomes and to reduce the negative outcomes associated with LEA, whether intentional or unintentional. Athletes, a sports dietitian should be referred to a sports dietitian to help restore that energy deficit. And in the case of an intentional low energy availability, the athlete may need a higher level of care. So it's important to think about the multidisciplinary team approach. So the sports med doc, the psychologist, with an expertise in eating disorders or disordered eating. And then finally, I just think challenging athletes to fuel and on their next run or whatever their adventure is, to really, challenge yourself to do better.
Are there any resources that athletes could look for on where they can find this information on how to properly fuel? And are there any reliable sites, places that they can look for that information?
Yeah, I can think of a few places. Team USA Nutrition has some fact sheets that they may look at. Collegiate Professionals in Sports Dietetics, they have fact sheets for the collegiate athlete. Shippen, which is a dietetic practice group of the Academy of Nutrition and Dietetics, also has fact sheets for athletes. So
also, your Instagram page is pretty informational.
Yeah, there's a lot of great Instagram pages out there, but I'm under K Pritchett RD, Inside Sports Nutrition, which I work with Dr. Namrita Brooke on, and we really focus a little bit more on the research side of things and have a few posts up and a blog about female athletes, and more specifically, and then CW Sports Nutrition would be another site you could go to.
Okay. And what would be your advice for future scientists that want to pursue that field of investigation? What are your tips and maybe the highlights or priorities on research that you see for this field?
Yeah, I would say if you're passionate about the topic, then, find a good mentor that is working in that space, number one, and, don't be afraid to pursue it, but also you've got to do your reading and you got to do the legwork ahead of time. But I would say, what I would love to see done is look at the impact and efficacy of an educational intervention, right? So we may be changing the knowledge of athletes, but how can we change their behaviors? And so I think behavior change, which seems a little how do we measuring that? And so I think you need more studies looking at educational interventions and the impact or effectiveness.
Yeah.
I think we see it amongst our three boys that are fairly active, and through constant communication and constant chatter in the household about fueling, our kids bring up these really interesting nuggets of information. For instance, our 12-year-old said last night at the dinner table that at his last zones swim meet, he didn't fuel correctly. So the constant bombardment of information does play into an athlete's decision making.
Yeah, I was really impressed when I heard that. And I'm like, well, okay, here's what we can do next time, Liam.
That's great. Kelly, where can we find you? Give us your Instagram page again, other social media or email contacts that people can reach out to you.
Yeah, I'm at K Pritchett RD on Instagram and CW Sports Nutrition and Inside Sports Nutrition. I don't need another Instagram page. And I also consult with Wahoo Running and with Free Trail. So those are two. If I do see athletes on a one-on-one consulting basis, and then Robert and I have our private practice or consulting business, Tridimensional Consulting, where Robert does the running coaching and I help with the sports nutrition side of things.
Good. Dr. Robert Pritchett, where can we find you? Tell us your social media pages or contact information.
I just support my wife on her social media and ask her what she's doing when she should be cooking supper, but she's on the telephone.
Oh, no, that's not true.
No, I'm not on social media, except we do have our Tridimensional Consulting side hustle.
Yeah, and you can find us at Science Her Way Pod on Instagram, YouTube channel, and so please follow us if you like this episode. We would like to really thank Dr. Kelly Pritchett for being here today. I feel smarter already.
So much great information.
Excellent. Yeah. Thanks for having me.
Thank you, guys.